most common myths that we hear about LASIK is that contact lenses are a safer way to see. The truth is, contact lenses give you about an 8 to 10-fold increased risk of infection versus LASIK. And whereas with LASIK, you take on that risk for one point in time, typically the first 1 to 3 days after surgery, with contacts, you take that risk every time you put that inside your eye. So another myth we hear about LASIK is that it wears off, that it's not permanent. But the lasers make a permanent change on the cornea, and you would see those changes there 5 years, 10 years, 20 years down the line. So a very common myth we hear about LASIK is that I'm too old to have LASIK. Now that might be true, that LASIK's not the ideal procedure for you, but the good news is, as a refractive surgery practice that does all 7 procedures in refractive surgery, if LASIK isn't the right procedure for you based on the power of your eye, the shape of your eye, or your visual needs, we have opportunity to look at things like refractive lens exchange, refractive cataract surgery, or even using a technique called blended vision with LASIK to give you range and meet your visual needs. Another myth we hear about LASIK is that it doesn't treat astigmatism. But since 2004, as we've changed the beam pattern of the laser and now even added other features like laser trackers and registration systems to ensure that we can track your eye as it rotates. That's one of the best things LASIK does, is it gets rid of astigmatism instead of just trying to neutralize it or cancel it out, which is the technique you use in contacts or glasses. So lasers treat astigmatism at a really high level, and people love it when it's gone.